So, hi Jake. Thank you for taking the time to be here and congratulations on becoming board certified. I should really be calling you Dr. Batuhan instead of Jake.
No worries. It feels weird for me also. Still
Mhm.
feels new and somewhat fraudulent. But yeah, it's nice to finally get the letters after my name.
Yeah, it's something that you've been working long and hard for. So, the fruit of your labor has appeared.
Yeah, yeah.
So you've been someone that I've actually admired since I've known you, and blew my mind even further during the entire time you were at school because you've juggled so many things all at once: school, your relationship, your social life, family, um, and then at the same time, you still made an effort to keep fit and healthy throughout. So can you share with us a little bit more about, the lifestyle that you've built for yourself?
Okay. Well, thank you for making it sound very difficult. I think once I had all those things on my plate, per se, it essentially just becomes a task of prioritization and time management, really. Like medical school or any other difficult field, I think a lot of us will find it hard to just focus on one thing. I mean, we don't really live one-dimensional lives. There's always lots of things going on. So those that will be able to rise to the top of their fields or make it in anything difficult will be able to kind of handle everything to the best of their ability. So in terms of how I did it, I think with medical school specifically, so just to focus on the education aspect, it's a battle. I'm sure Amir is also telling you things about her experience, and um, it's essentially a mental onslaught kind of for 5 years. It's being given material that's extremely complex, very wide-ranging, usually not related to each other. One day you're studying head and neck anatomy, the next week it might be liver function. So it kind of just becomes how you live your life around learning that material to the best of your ability and then being able to tackle the exams which ask you questions which may or may not have been in that material. So essentially, you know it's going to be a battle. You know that it's hard, it's difficult, and there's other things still going on in your life. So something that really affected me in my first year, it was our hematology professor, and this is like one of our first few lectures in med school, so we're still kind of getting adjusted. And he walked into the room, and we were all there, fresh med students, just fresh out of college, still kind of scared. And he looked at us and he said, "Burn your ships." And no prior context. We're like, what
Mhm.
does that even mean? He said, "Burn your ships." And then he began the lecture with a story. I'm not a Greek historian, but from my memory, it was something along the lines of the Persian army had arrived on the shores of Sparta to kind of claim the city. And once the army had disembarked off of the ships, the commanders or the generals went and burned all of the ships. So they had no way back. And essentially, he said, we have to do the same thing. You're here now. You're on the shores of Sparta. You took your ships. You made this journey all the way here. Give yourself no other option other than to finish the 5 years of medical school, or whatever, battle is in front of you. And that kind of changed my perspective on it because once you give yourself no way out, it kind of forces you to adapt. It's kind of like survival instinct kicked in. It's like, okay, I'm in this situation now. I wanted to be here. My parents, my friends, my family have done all of this to put me in this position. It's kind of on me now to finish this journey. So by burning my ship, so to speak, I never really questioned, why do I want to do this? Why do I want to be here? Although I did, but not to the extent where I'm like, okay, I'm out. I just kind of said to myself, it was like a little mental task. It's like, this is where I'm at now. This is what I have to do. This is where I have to be. So let's do it. So once you kind of remove that exit strategy from your mind, everything else, all your mental focus becomes, okay, how can I get through it? So I think burning my ships was a really big one, that helped me get through it. And then everything else, like my relationship with Charu, who's now my fiance, um, That I don't think of that as extra work. That was kind of like a nice that was a break for me. I know that people can view relationships as being time consuming and difficult, but having a partner that's not in medicine, it's really nice to go back and not have to talk about the Krebs cycle or not talk about toxic patient in Ward 14 or something like that. So it was a nice outlet, and she's, you know, incredibly supportive, and it's such a big reason of why I'm here today. So yeah, I think of that more of a blessing than anything else. And with regards to like health and fitness, it's just it's something that I resonate with very strongly, and I know you do too. Um, as physicians or doctors or really any healthcare providers, the point of what we're trying to do is make someone healthy, you know, whether that's relieving liver cancer, diabetes, hypertension, doing a surgery. It's so that you can live a better, healthier, more fulfilling life. And there's many ways to argue about what that means exactly or how to go about it. But I think everyone agrees that's what we're trying to do. And I think if more people focused on the primordial aspect or the very beginnings of health, which is, you know, so much of what you talk about, like what you put in your mouth, how do you deal with mental health, how do you do all these things, I think, you know, almost instantly there'd be a massive reduction in the types of lifestyle diseases that we're all dying from now: hypertension, diabetes, certain types of cancer. Western medicine is really good at the cure. We're fantastic at it. You come to us with end stage renal disease, end stage, you know, something or other. We might be able, or there's a good chance that we can help you treat it. We are not so great at approaching someone as a teenager, early 20s, early 30s, being like, hey, eat this, live like this, work out this much, which would even stop you from reaching that, you know, that stage of progression in your disease cycle anyway. And there's many reasons for this. I don't know if you want to get into it, but yeah, so I'm glad that there's a shift now towards that aspect of health, even public health as well, helping those that don't have access to education, the resources that we have, just so that overall we can improve, I guess, the global health, if you want to think of it that way. And in terms of like, how did I set my lifestyle up to be like this? I didn't. I absolutely lucked my way into this. I'm sure you remember it was you, me, Thomas, Sean, and Amira, I think, that wanted to do med when we were in high school. And yeah, so for me, it was just, okay, this is it. I didn't really question, you know, do I want to do anything else? I stuck with it. And again, my family and friends just provided the platform for me to do it. So yeah, I wish I could say I did some magnificent thing for my life to be set up like that, but I lucked my way into it, and then after that, it was just, okay, this is the reality of my situation. How do I deal with it? And then yeah, that's kind of how I got here.
Nice. So thank you for sharing all of that. That was such like a condensed summary of your entire life and how you were able to kind of do it all. And it's very interesting for me when kind of the keywords that you've used, like commitment, perspective, and the whole analogy with the ships burning. What really struck me is that it brings up that idea that instead of asking or telling yourself, oh my God, I have so many things to do, I'm going to go crazy, how can I do all of it? It's kind of like you're focusing on, all right, this is what I've got, this is what I've want. What do I need to do to make this work? Or what can I do to make this work? And so having that mindset of, well, I'm here, might as well find a way to make it work, and asking what I can do, and then having those resources of support like your fiance, your family, your friends as breathers or people who help you rather than people who burden you. And having that very positive attitude, I think, helped make a difference. It sounds like it made a big difference for you.
Yeah, definitely. I think there's another saying. I hope I'm not just gonna devolve into repeating a bunch of anecdotes, but essentially it's like life is 10% what happens, so objective reality, 90% how you perceive it, and then how you go on to deal with it. So things can happen in your life. Like say I have, you know, a long-term relationship, and I have to spend time with Charu or whoever your significant other is, instead of being like, oh, okay, but I really would rather be studying or something like this. Your perception should then be, okay, I am going to spend time with her. And it is actually a benefit for me because one, I can take a break. And two, even working with her or just being around her and then, doing our work together, it's far better than if I was cramped up in the condo, just kind of in this echo chamber of insanity with all the work that I have going on. So it's really just perceiving things and learning mental hacks on how to see the brighter side, essentially, which I remember you in high school, we always thought you had the happiest, smiliest face. So it's probably something you also did. But yeah, just learning to see the bright side in things.
Yeah, and the importance of giving a space to each aspect of your life and not letting, medical school consume the rest of it, because there's that anxiety, that fear of it's medical school, it's intimidating, it's a lot. And I'm sure yeah, people come into it expecting one thing and then getting something else totally.
Mhm, mhm. Yeah.
Well, okay, so now that you've graduated and you've had 5 years and more, including undergrad, of this whole intense kind of life, very disciplined lifestyle, was it all worth it?
Yeah, without a shadow of a doubt. It was hard. It was, at the times you do question yourself, um, especially during board exams. I'm not sure if you want to get into that later, but just really during long periods of somewhat isolated studying or focusing on a task wherein there is no short-term or immediate reward. The reward is far, far, far in the future. It can get difficult and it can be hard to see, the future version of you where you've accomplished, your goals, your dreams, your objectives. And in that moment, like, any other human, it can be very easy to want to quit, to want to, be like, technically, I don't really have to be here. You can walk out of a classroom, you cannot take an exam, you can quit. So the exit strategy is there if you wanted to take it. But the trick is one, burning your ships, and then two, kind of delayed gratification. And there's a lot of work on this, how to improve it, how to instill it in your children, how to live a life where you can not procrastinate and really visualize your goals and dream boards and things of that nature. But in terms of was it worth it, yeah. And I think one of the biggest things was the COVID pandemic. I know it was extremely hard on everyone. It was, to my knowledge, other than maybe world wars, the only thing where, almost the entire world was affected. We all went through a similar experience of being stuck at home, helpless, seeing, leaders and authority figures sometimes mess up really badly, sometimes do things that are completely corrupt, and you just felt powerless at home. So that kind of strengthened my inner belief that, like, yeah, this is what I was supposed to do. I want to heal people. I want to be in a position where I can influence society for the better. And yeah, I mean, sitting here now after the board exams, I'd still say I'm only 40% through my medical journey. I have other exams and residencies and things to accomplish. But as of right now, like everything that I've gone through, was it worth it? Yeah, definitely. I wouldn't trade it for anything in the world. Maybe I wouldn't do it again, the medical part, but yeah, I definitely say it's worth it. Yeah.
Yeah, so it sounds like it's something that really aligned with your values, and yeah, the career path that you've chosen speaks to your core values. And so going back to that period of time where you're speaking about having that long-term vision, and it's very delayed gratification. So
Mhm.
can you share with us a specific example of a time where you've kind of lost focus or felt like, oh, how do I hang on? How do I continue? How did you kind of overcome it and get back on track?
Yeah, so I briefly mentioned this before, but actually the PLE, or the physician licensure exam for the Philippines, it's very difficult, not just because of all the things you have to remember, which is crazy in and of itself, but also the mental onslaught. So for most schools, this changed a little bit because of the pandemic, but medical schools will finish their internship roughly around July. And then you will have August, September, October, about 3 to 4 months to really just be on your own and study the material for the board exams. And the thing that I guess they don't tell you is that when you give someone who's been working, extremely hard for 5 years, a 4 month period with no guideline or schedule essentially, and be like, okay, learn this book, guess what? They're not going to do it immediately. They're going to push
Yeah.
it off a little bit and, go to the beach or go to the gym or, talk to friends and go out and stuff like any other normal person would. So in terms of when I lost discipline, or one of the hardest times in medical school actually is preparing for those board exams, because you're not going into the hospital or to a classroom 8 to 5 and there's a teacher standing over you, over your shoulder, being like, okay, what's this? What's that? No, you're at home and you have, this many books, chapters, things to read and learn. And it's on you. It's on your shoulders. There's no one else telling you to do it. You just kind of have to get through that material yourself. So in terms of when I lost focus, yeah, definitely there. Not because I questioned, do I want to be a doctor, but um, it just so happened that that was the time I decided I'd also propose to Charu, to my long-term girlfriend, who's now fiance. The So we did it in Paris, and of course, planning that with the photographer and the logistics, all of that. I decided to take her to Paris after the board exams and then do it there. Now, in order for that to happen, I had to do all the planning, all the stuff, and this occurred while I was studying for the board exam. So on top of the yeah, so on top of all the crazy stuff I had to learn, and all the, the self-questioning and self-doubt, there was the very real logistical planning for that big event. And in terms of how I got myself back into it, it's kind of just really thinking about the consequences of what would happen if I were to announce the engagement and then have failed my board exam. So there was, very real things that could have happened if I didn't study properly. But in terms of advice that I could give to your listeners and viewers, how to get back on track, I think it's number one, accept that you're human. Um, Everyone, the smartest person, the most resilient person, the David Gogginses of the world, the really hardcore self-belief, motivational type people, they're human and they go through it too. And they have, mental health issues to some extent. They have things going on in their life. And it's okay to take a break sometimes. It's okay to not be 100% every single day. In fact, it's impossible. So that's not really what you should be aiming for. A more better and achievable goal, this is spoken about in the book Atomic Habits, but something along the lines of be 1% better every day, right? So
Yep.
making small changes, making your bed. In terms of how I can relate that to the board exams, it's like, okay, I really should be reading 100 pages. I can't. I'm not in that place right now. Maybe I can read 20 and do these flashcards. Maybe I can listen to this podcast of a similar topic on anatomy and do these things instead. So it's more about being realistic with your goals and your objectives, understanding that you're human, and still maintaining that drive to be like, this is my battle and this is what I have to do. And it's not easy, but it's definitely possible. It's definitely possible.
Yeah. So then you used a lot of self-compassion, listening to your body, your mind, and the condition that you were in, and then kind of having still that framework of these are the things that I need to get done, but having that flexibility within the structure to say, but this is what I can do for now.
Exactly. That's exactly it. I don't want to come off as a type that's like, you have to do this no matter what, like a hardcore Marine drill commander. That works for some people.
Mhm.
But for the most part, it will be finding that balance of instilling like a burning desire to finish what you've set out, and also understanding that there are times that you need to take a break. And I think throughout our lives, we're gonna be, finding that balance between friends and family, and between work, or between, this holiday or this family crisis that just happened, and whatever you have to do for that day. So it's not perfect. It'll constantly be tweaked, but yeah, I think that's essentially the scale that we'll all have to balance as we become adults and do adult things.
Yeah. And as you were sharing that, this analogy kind of popped up in my mind, which was life is a marathon. It's not a sprint.
Exactly.
So
Yeah.
yes, you have to pace yourself. You know, rest is as productive as being productive or
100%.
doing something actively. Great.